Good afternoon. Welcome to the first class of Axe Fest, July 15th, Thursday, 2021. And we are at the Axe Media Group headquarters right here in Springfield, Missouri. Way out on West Kearney for the people who live in the Springfield area. 2 more blocks down west on Kearney Street, you'll run into the old airport parking lot. Been there many times growing up. And that's where we're located. And today I've got Dr. Tricia Derges, and she is a tremendous young lady that's going to tell you about a social cause that she has pioneered, created, started, and still fulfilling her dream. And by the way, we actually saw, and she brought Patch Adams, Dr. Patch Adams, in Tuesday night in Springfield. Had a big crowd, and he's kind of the pioneer. And of course, Robin Williams did it. The movie made him famous in 1993, and the books and different things that have been about him. He is really what they portray, but she is too. So I think you're the sister of Patch Adams.
He actually, when he called me, heard what we do, and he said he'd never heard another hymn before. And he goes, "You're like my sister," which is cool because I'm actually, a lot of people refer to me as the modern day Patch Adams. So it was kind of really an honor for somebody like this that I have looked at as a hero. Before I even went to medical school, my 50s, I just thought he was one of the greatest movies I ever saw. And I was like, what a way to live. And so when he reached out to me, it was like, I'll never forget that phone call my entire life. And then when he came here, this week and stayed at my home, and he's the real deal, guys. He's the real deal.
Well, very good. Now, before we get started, I want people to know we got people online watching all over the world, not just in the United States. We have a lady from Denver, Colorado. We have a lady from Ada, Oklahoma. Is that what you said? Ada, Oklahoma. Anybody else outside the state of Missouri right here? We've got more people coming from Branson because a lot of them went to the Blackwood Brothers this morning. This kicks off Axe Fest, the 3-day event that we've done for 21 years. 21 years out of 27 years of the originating of Axe Ministry with Dr. Paul Collins. And now Dr. Jim Whining has taken over. And then also, like Jim said, I'd love for y'all to tune in on Wednesday mornings at 10 a.m. I'm going to give a plug because I'm a volunteer up here, just like we all are volunteers. Everyone watching today, everyone, the Axe Ministry group, volunteers. There's no paid people. And so I would love for you to watch our show. Don Blackard, my co-host, an 18-month Iraqi war veteran from Nixa, Missouri. She and I co-host a show called Changing Times. And I think we all would agree we are in the middle of changing times. And not necessarily always for the best. And so us Christians have got to take a stand. And we've got to make sure that we turn the tide on anything that's negative or bad for this country. And I will be part of that. I'm hoping that you all will be part of that too, that we can do that. But we talk about social issues, social causes every Wednesday at 10 a.m. The good news is, if you miss it, because everybody's busy, you can watch it on the Library of Axe Media Group Facebook page. You can watch Human Trafficking, which was #1 show 15 weeks ago. Next week will be 16 weeks. And so we'd love for you to do that. But we're going to get right into what we want to talk about, the challenges in social causes, the challenges. And Dr. Derges, tell the people, what is your social cause that you're really working on?
My social cause is my mission clinic, Lift Up Springfield. The technical name is Lift Up Someone Today, but I made it that way so it could be Lift Up Springfield, Lift Up Dallas, Lift Up wherever we need to lift people up. And this was something that came to me. I knew the good Lord was sending me in a direction. I thought it was kind of crazy at first. I had a manufacturing company for many years. And then in my 50s, I sold it and made the decision to go to medical school. Yeah, exactly. So a little bit on the crazy side too. But I went to medical school, hardest thing I ever did. But when I finished, and I was almost finished, in my clinical training here, I ran into a patient. It was actually my second patient. And he came in with a really bad toothache. I mean, it was really bad. And I explained to him, I could give you antibiotics, but you're going to need to get this tooth pulled. And because otherwise you'll end up with endocarditis potentially and die, which is not a good thing, right? So I'll never forget, because I believe that at that time, and I think people believe this today, is, as I said, you need to go to the low-income clinics here in Springfield. They'll pull your tooth. And he said, well, I can't. I don't qualify. I said, wait a minute. You have no money, but you can't qualify for a low-income clinic. That doesn't make sense. I said, how can you not qualify if you have no money, right? Okay, here's what I found out. He said, well, how do you qualify? How do you have an address if you live in a car, or you live in a railroad track, or you just got out of prison? And I was like, oh my gosh, I never thought about that. I don't think anybody does. So if you can't qualify, guess what? You get turned away. And this man, I'll never forget that I knew why God sent me this way. He said, I will just go home and pull my tooth with my pliers. I was sick to my stomach, and the man did that. But I made a promise to him, and that's what my social cause is today. I said, when I get done with my schooling, I promise you, I give you my word, I will do something about this. This is wrong. This is wrong in this country. Anywhere in the world, it's wrong. So when I finished, that's what I did. So lift up someone today. I don't know anything about dental stuff and mental health. I mean, that's special training, but the doctor end of it, yes. So I found a little tiny building up in the area where the homeless were, and I rented this little dump. We're still in that dump today. But in that dump, I made the decision, we're not going to take any aid. No one's going to tell me who I can and can't help. That's what I love about Patch Adams. Except he was a medical student. He didn't even have a license at the time. More power to him. But he saw the need of the people, and that's what Lift Up Springfield did. So I got some input, some help. I put stuff together in this little tiny place, and we put a notice out there that we were going to help with medical, dental, and mental health, because these people being turned away, we found, have not seen dentists and doctors in 10, 15, or more years. We see worse things in our little tiny clinic than we do in third world countries. Trust me, it's really bad, and we're a brick wall to them. They have nowhere else to go. We're their last stopping point. So if we can't help them, they return to the pain, early deaths. They can't get any medicine. They can't even hardly put food on the table. So that's kind of my cause, and that's what we do. We've been going now, and I know we're going to talk about lots of parts of it, but Lift Up Springfield is my cause, and that's what I love, Patch. So I watched this movie after I finished med school, and I was like, whoa. Yes, this is what I'm doing. And so that's what I do. And I love it. I absolutely love it.
Well, that's great. So, Dr. Derges, so who are some of the other people you serve? I mean, they're not just older people, they're younger people. There's, veterans, seniors. They're kind of all over the place, aren't they?
We lift up, everybody goes, and that's a popular question. It's like, so who's your patient? If you don't qualify, so who's your patient? Well, anyone in need of help is our patient. Like COVID that's gone on, at 10 o'clock you might have a job and insurance, and at 1 o'clock you don't. You're now a lift up patient because you can't get help. So we help everything. We have a lot of homeless that we see, as you can imagine. A lot of impoverished people below the poverty level. They can't even put food on their table. They can't afford medical help. We see people released from prisons and jails because they, what people don't realize, they take care of a mother in their jail, and then when they open the door to send them out, you know what they do? They give them about a week's worth of medicine, say, hey, good luck, best of luck to you. What do you do with that? We see the elderly that don't have a lot of money, they can't afford dental or sometimes medical care, even though they're the Medicaid and Medicare's out there. No, we don't take any insurance. We aren't there to make money. We don't make money. Which is fine with me. That's the problem. Doctors like to make money. I don't care. I haven't taken a paycheck since I got out of medical school in 7 years. Patch hasn't taken one in over 50 years. I got a lot of catching up to do with him. But, my pay, I've raised my kids. I got 8 kids, almost 24 grandkids. So I raised my kids. I don't need this. So I love to, and Patches are hugs and tears. So we see the elderly. We see battered women. We see veterans, and the veterans we see are homeless, and that's the one that upsets me the most is the veterans. There's no excuse for that, but we see them all the time. We see the churches send people, the Christian Foundation, if you name it, out there, if somebody needs help, even get this, the low-income clinics send people to us. But at least, thank goodness, they have somewhere to send them now instead of just saying, oh, we can't help you. We're also on the discharge list of the emergency rooms, because guess who all goes into the emergency rooms? The people that don't have any money. So they send them to us. So we have become a huge resource for everyone. And then a unique resource that we didn't count on when we first started and opened the door is that we have medical students from not just Missouri, but from around the world that come in and do clinical rotations so they can earn credits. Every college and university here, or VOTech school in Springfield, they send students over so they can actually volunteer, get their credits to get their degree. And so it's in nurses. We have become an educational resource too, which has been absolutely wonderful. So we help everyone. We've had, not just from Southwest Missouri, we've had people from Colorado. We had a single mom, couldn't get any dental help. She drove 16 hours one day, got here at 6 o'clock. We had her back on the road by 9. So we've helped from other states all over Missouri, but predominantly Southwest Missouri counties are mostly what we've served.
And so, so we kind of answered the question about location, because most of your patients are Southwest Missouri, but you've got people, like you said, they're coming to Missouri, they're visiting either family or relatives, they're moving to Missouri for jobs and a better future, better way, and so you're serving a lot of people. And kind of tell the people about their needs that you see. I'm diabetic, so I know you see diabetic patients. But you see people with all kinds of needs. Now you have medical, dental, and psychiatric.
Mental health.
Oh, mental health
counseling.
Counseling.
Psychiatry.
No, so mental health.
I
need the psych part. But anyway, so you know, you've got all that, and you're seeing patients that need all those, right?
Yeah, and what people don't understand, and I think people know this, but they don't hear it, is that everything about you makes your health. We might be able to take care of you on a health-related end, but if you've got serious dental issues, that leads, this is this massive vicious cycle. And everybody is a specialist. Oh, they treat only this, and they treat only this. You know, the average time I spend with a patient, my first visit, is several hours. Because I want to listen to you. I want to know what's going on. The average patient, I believe even Patch gave this figure on Tuesday night, 7.4 minutes is what a doctor spends with a patient today. And I think everybody's shaking your head here. You understand and you agree. There is no way they can know what's wrong with you or know anything about what the medicine is. They just hand you, oh, here, take this, right? Here, take this. You don't even know. I bet you go to the medicine cabinet, you don't even know what names are on those things, okay? So I spend a long time because our patients, especially our patients, are very complex. I would say 3/4 of them absolutely are diabetic. Blood sugars at 600 when they walk in the door. I don't know if they're going to be even alive the next week, but guess what? Their insulin's only about $800 a month. I don't know why they're not taking care of the problem. Why bother to eat? I don't need a house, just get insulin. So we take a lot of donations. So now when we first opened, we didn't have any, and it ripped my heart out. You know, there were times I would give people money for their medicines because they had nothing. And I was like, this person's going to be dead in a week if I don't do something. Now we've had enough donations. I have a refrigerator full of insulin, so we really are able to help those that really need that. Hypertension, oh my goodness, through the roof. Okay, hypertension. So because all of these people are living on food pantry things. So you're talking about processed food and canned food. Well, guess what that does to the vicious cycle? So that's one of the projects that I'm working on right now is the first healthy food pantry in the country. So we're doing a flash freeze dry program. I'm not done. I have to continue to work, get it finished. We're almost there. But this will allow my chronic patients to break this horrible cycle they're in. You know, because medicines aren't going to do it on their own. It's a whole big thing. So we will sit, and I will sit and draw pictures on the exam. Most of my patients never sit on the exam table. I use it to draw on. I draw and explain to them. I feel that when you can be empowered with understanding about what's wrong with you, you're going to do a better job at taking care of yourself. But in 7.4 minutes, I can't do that. That takes more like a couple of hours. So I explain why hypertension is deadly. Not just tell you, oh, well, you need to take this to keep your blood pressure down. You need to understand why. Diabetes, we see cancers. I've seen cancers come in, and what's sad, what kills me is when I have patients come in that are, I know exactly in 2 seconds what's wrong with them. And it's one lady had a horrible basal cell carcinoma, already almost went all the way through her cheek, huge. And this is what I see all the time. People will come in, well, I saw a doctor, but they didn't see anything was wrong with me. I said, no, they saw there was something wrong with you, but they know you couldn't pay them, so there's the door. And that's what I see all the time, and it makes me so angry. Everybody's in it for what kind of money, and that's the problem. Lynn has been in the legislature. Now I'm a state representative, and we see this. The medical associations aren't interested. They want to keep people in medicines, and there's too much money here. So they don't like that. So that's what is amazing. We take time to educate patients. We empower them with what the medicine is. Some people bring a bag of medicines like this in to see. They're taking medicines for side effects of side effects of side effects, and then they don't know what it was that they got a side effect from. And so we actually take it apart because I don't like a lot of medicines. Are there some that you need? Of course there are. But we don't take time to listen to the patients, and that's what we do. But we see cancers, we see, I can't even list the things that we have seen come in our clinic. Like I said, you don't see a lot of things that, even in third world countries, I've done medical missions too. It's really sad.
Well, very good. So what is some of the main challenges that you face with your social cause of trying to help people and uplift people?
Well, the first is getting them to understand that, we don't take any aid, state or federal or anything. Like the low-income clinics, they get great checks every month. They have real fancy facilities. So we don't do that. If I do, then I can't see you and I can see you, but I can't see you and I can see you. And I can't operate that way. I can't go home and sleep at night. So the challenges is that the public still thinks, because we deal with the homeless and poor and this group of patients, that we don't need any help. We're being taken care of, even though we tell them all the time, we work by donations only. That's the only thing we can do. So that's the first problem. The second problem is that when you're talking about, we work with volunteers, nurses, dentists, doctors, okay? So trying to get, a dentist or a doctor out of their nice, pretty, fancy office to come over for a few hours. I only ask a doctor or dentist can you 4 hours once a year? Do you not have 4 hours? That's a lot, isn't it? 4 hours to leave your fancy clinic to come over and help somebody that is in horrible pain every single day. I had a mom come in with 2 little boys, came in off the street one day, and she was in tears. She was in so much pain. Her teeth were jagged. They were broken. She had not eaten in 2 weeks. She just had soup. She was in so much, we see it all the time. She was in so much pain. So we got her taken care of, just the most precious little boys, and she left in, a nice life. We're working on putting a 3D, well, we actually have the things, we've got to finish the training, a 3D denture program so that we can get dentures for our patients in 1 day instead of the 2 months that it's taken us, because we actually make these by hand. So we're making improvements, but it's the donations that's a big problem. We just, getting money, I love it. I would love, my dream has been since day one is to have build a small hospital in this area so that we can actually do real things for these patients, have actually modern facilities instead of what we're in right now with the leaking roof and everything. But, in 5 years, 5.5 years we've been there, we've treated, I could count it, 25,000 people in visits that come in. I don't know where we're at now, but these are people we've stopped their pain, saved their life, saved limbs. I've saved several diabetic limbs. And it's just, there's nothing that can describe that, but that's the problem, is getting people out to volunteer and then getting money in, because people just, of course, and I understand that today with everything that's going on, but, we still have to pay rent. We still, we can't do these wonderful things you'd like to without some, we need the donations. That's the biggest part, and the volunteers.
And so, when you're talking about volunteers, Dr. Derges, you're highly trained. You need people that are highly trained. Not everybody can walk off the street and fix a tooth. The dentists don't grow on trees. And so you've got to have nurses, you've got to have dentists, you've got to have doctors and counselors, you got to have all those people. I know there's one of my friends from Branson that's a retired dentist that was working at your clinic in Branson. I don't know whether he's still doing that or not. But we need to find, if everyone's listening out there today, one of the things that obviously you have to have money to run an organization like this. nothing's free. Somebody's got to pay for it. And so you're providing a free service or reduced service, whatever the people can afford to pay. And I have a feeling that a lot of them can't afford to pay very much. And so we've got to, but if you're a nurse or a doctor or a dentist or anything in the healthcare disciplines that you could help lift up Springfield, just volunteering once a week, once a month.
Hey, 4 hours a year, guys. 4 hours a year.
I mean,
It's not a lot.
You'll take anything that someone would volunteer. So hey, let's get into a little bit more of the. Oh, I want to say one thing. So let me ask you a question. You piqued my interest a while ago. I hadn't heard this before. So when you're talking to the patient and say you've got patient 3 or 4 hours, and are you drawing pictures on the exam table on the paper?
I'm a Picasso too.
That's what I was going to tell you. I honestly think not only are you a doctor, but you could be a Picasso. Just very briefly, I got sunburned a long time ago in Mexico when I was trying to stay out in the sun with my grandkids. I'm the only one who got sunburned. So the doctor told me that I couldn't be out in the sun for 3 days. And so I did pottery. And all the people that was doing pottery was over 60, except I was in my 20s. And so I didn't really look like everybody else in the class. And so they were in Mexico, and everybody in Mexico, you know, bright colors, red, blue, yellow, all bright colors. Okay, happy. Okay, well, guess what? I painted black and dark green and brown and tan. I did those colors. And I remember that lady telling me, I couldn't understand what she was saying, but she said, now look at that Picasso. He's an angry Picasso. So when you said that, I thought, that reminded me of that. But hey, so Lift Up Springfield, how do people find out more about Lift Up Springfield? If they wanted to call you or locate you or find you on Facebook, what do we do?
Well, we have a website, liftupspringfield.org, and that tells you about everything you need to know. We do all of our, we're still very old-fashioned. We do all of our communications by email because, again, with volunteers, we can't afford. Now, we have our wish list, our dream list, but right now we have volunteers, so we're just in there when we can get volunteers. So we work through the email because we can't pay somebody to answer the phone. So going through the websites, the easiest way by far. So all of that helps. If you go, we can answer. There's places to do donations. There's, you can get in touch. You can email through there too, or questions, and I'll get back with you. My staff that helps, everybody helps, because one of the things we do get some help and as far as donations, we don't get a lot of donations. We know that one day we will, but one of the things that does help, because we do have to pay overhead. One of the things I found is once we opened our clinics, we started seeing people come in that really shouldn't be there. They weren't there though to get free services or low services. They felt actually really bad about coming in because they felt like they were taking somebody's spot that needed it. But yet they didn't have insurance, so they couldn't afford health care either. Okay, or they had insurance with a $20,000 deductible, and these people can't afford it either. So I put a couple of other clinics in that were for the working person. So that way people could come in at a very low cost if you've got a job and get taken care of. So what I do with those clinics is I allow whatever's left at the end of the day of those clinics. We have one in Springfield, Ozark, and Branson. We take that money and it helps support Lift Up. So, or I pay for it out of my pocket. So it's, one day we want to have that wish list. So that wish list would be a small hospital, or I'd be settled for a nicer little clinic right now with modern equipment. But I'm thankful for whatever, because the good Lord's made it work for 5.5 years. And some days and some months, I have no idea where the money even comes from. Honestly, I really don't. It just somehow it works. But, contacting through the website is the easiest, and I get the messages. It's just like Patch. He checks every message that he gets.
So what's your website?
It's liftupspringfield.org.
Liftupspringfield.org. That's pretty simple.
And you can email directly to clinic@liftupspringfield.org. Direct email. But we would love volunteers. Obviously, donations are great. It's just a neat thing. And here's the coolest thing I tell volunteers. The volunteers are the ones that really get their lives changed when they come in. Because most people I want to do a day of volunteering. So they go to a pantry and they pack boxes or they pack clothes, and that's all they see, right? That's all they see. They never know what happens with that box or the clothes. They get a real surprise when they come into LiftFed because they come face to face with that patient, face to face. They see the tears and the pain, and it wakes them up. And they're like, so you think you have problems, you just come spend a day at LiftUp. It'll take care of those problems. I always say when you're in the service of somebody else, you forget your problems. And that always happens 100% of the time. And they turn around and they leave and they get that hug from that patient and says, thank you. They never forget that. And then they like to come back and volunteer when before it was just, well, let me check this off my list for the year. So they get a kind of a surprise when they come in to volunteer, and we love volunteers. We do meals for the homeless a lot of times, Christmas and Veteran Day. We're just random days. We've actually got another one we're going to do here pretty soon. So we love it.
Now, let me tell about the meals. This is a great thing. So I go up there and help at Christmas time, Thanksgiving, things like that. So last Christmas, what did we feed? 300 or 400 people?
Yeah, 400 people we
I
could.
think we ran out of food. It's not. I
Yeah,
mean,
okay, it's
eventually we ran out of food. I was in charge of ham and turkey. I mean, what better place to
We
be
ate
in
every
charge?
other time.
I mean, man, those big old pieces of turkey and ham, and then somebody else is in charge of potatoes, and somebody was in charge of green beans, and somebody was in charge of a roll, and somebody was in charge of the salad, and we had water. It was awesome. And then it was like you said, when you saw those people driving up, it got you.
Yeah, it does.
Yeah.
When you see veterans coming across that parking lot
Yeah.
and ask, is it okay if I take a second bag so I have something to eat later tonight? You don't forget that stuff, guys. That's what you wish you could turn and let the people see. But, you know, it's sad they don't see that. And so many people don't like this. You'd be surprised. A lot of people don't like this.
Well, the coolest thing is we had all these people coming up and driving up, and they were also getting toys.
Oh, yeah,
So
we
they
had
kids.
toys for
They had kids. They got toys. I bet you some of the adults got toys too, because they're kids too. But you know what was neat was we didn't just wait. Dr. Derges' team of volunteers didn't just wait for the people to drive up. So in between all the people driving up and walking up, because a lot of them don't have cars and they're walking up, they find out that there's free food. And so they do take advantage of it, and I'm grateful for that. They would box up 15, 20 meals and take them to different homeless camps. It was awesome. Yeah.
Nothing's greater.
Yeah. So honestly, you know, I want you to know that I think you're a little bit crazy to go into medical school in your 50s. Most doctors are thinking about retiring in their 50s or 60s. The old doctors, you know, like me, I'm 72, I'm still practicing, and you practice. You don't ever retire, you know. But the young doctors today, they can't wait to get out. And I understand that because of insurance problems and the government interference with healthcare and everything else. I don't blame them for getting out early. But you don't see very many doctors today that have graduated in the last 10 or 15 years that want to practice medicine after they're 50 years of age. They just pretty well want to retire and get out.
I'm 63, so I'm just starting.
So yeah, so she is a young 63. But I just think that's amazing. And then when she went to medical school, this is more power for us older folks. No offense to the younger folks watching today and listening today, but she graduated #1 in her class. So graduated #1 in her class when most of the people in your class were probably in their 20s and 30s.
Oh yeah, they're I had, you know, when I was in school, that was the hardest. My brain actually hurt. I had a manufacturing company, and it was a big one. So that I got business down. I love business, but boy, this was different. My brain hurt, and I wanted to quit. And so when I finished, the hardest thing for me in medical school was the young kids. You know, you would walk down, and you'd hear them behind your back snickering. I actually had one kid walk up to me and goes, "Go home, old lady. You're never going to make it." And I was like, "You don't know me." But since we opened Lift Up Springfield, we have received national attention. Lift Up was awarded the Jacqueline Kennedy Onassis Award in Washington, D.C., which, so you'll know what that is, only 5 people in the United States are ever awarded that once a year. Oprah Winfrey's one. This is the Nobel Peace Prize for community service. So we received that. We were also the Humanitarian of the Year in 2018, and the Jefferson Award, and the top nonprofit. So we Lift Up has made, name across the country, and I really thought that would help make a difference. And that's what Pat said. He said, you have to go out and ask for what you want. I said, that's hard for me to do. But he said, that's the only way you can really get help. And so I understand that now, but I really hope that had made a difference, but we're still looking for making our dream come true. And we're still going to keep doing what we're doing because we are making a difference. Even if it's in one life, it doesn't matter. One life to stop in pain and hurting, and it's worth it. But we've done 25,000+, so we're going to keep going.
Oh, very good. We've got Matt, our producer. We can't see him, so he's in another room. Matt, how much time do we have left? Can you hear me, Matt?
15 minutes.
How many?
15.
Oh, 15 minutes. Well, we'll have some more stuff to talk about, but let's just kind of take a break and let's do this. Is there any questions that you have for Dr. Derges? This would be a tremendous opportunity that if you have any questions that kind of piques your interest of how she got started, why she went back to medical school, I will guarantee you she had a multi-million-dollar wholesale manufacturing business. For the women, most of the men don't watch QVC and some of the shows on TV where you buy 24 hours a day. But my wife, she's a shopping specialist, and what that means, she's defined that to me. Everything that she buys is on sale. She has saved me money. Don't worry, Lynn.
Right.
She always tells me, Lynn, don't worry, I've saved you money. What's really the best story is Kohl's. I imagine there's Kohl's all over the United States, so people will understand this. In Kohl's in Springfield, you get all these different discounts and money back and all this, and the receipts are real long. You may buy 4 items, but the receipt is real long because it's telling you how much you saved, and then it tells you how much more you saved because they took this off, and then it tells you how much more you saved here because you bought this, because you're a specialist in buying, and so I got 6 grandkids, and so she comes home all the time, and she shows me, it's like an accordion. She shows it to me, and she says, look, Lynn, how much I saved you. Look how much I saved you. And we bought 3 grandkids, 3 granddaughters today. So oh, wow, that's awesome. Keep it up. That's a good word. So anyway, is there anybody that's got a question? And otherwise, we'll start again.
Question.
Yes.
And part of what you do, how do you preach or spread the gospel to people? Do you go ahead and provide Bibles or other stuff, or how do you go ahead and preach the good news?
We do it a couple of different ways. One, because it is kind of an open public place, so we do have to be respectful of everyone's belief because we don't question anybody. Anybody can come in. We have a lot of people that will, a lot of churches will send literature over, or sometimes the churches will just send somebody over to sit in the waiting room and just talk to people. People forget, and that's what Patch reminded everybody of Tuesday night, is that people forget, we don't need antidepressants. We just have a lot of lonely people. So they'll send people over and talk, and if the conversation goes in the direction of a faith-based, they love it. We've had a lot of, we've had a lot of miracles happen in Lift Up. And when I say miracles, I do mean actual miracles. I don't mean like, oh, wow, that was a cool thing that happened. I mean, they happen enough that they're actually not surprising. So when those miracles happen, it's a perfect, you couldn't be given a better perfect opportunity to be able to talk about this when a real miracle, like the coolest miracle we had happen. We've had a lot, but this one actually got written up in a national paper. We are busy. And especially if we ever get a dentist, it's really busy, okay? And this is back when we were only in 1,000 square foot. Now we've branched out into a massive 2,000 square foot. Then 25,000 people had walked in. But this day was extremely busy. And if you didn't get an appointment previously set up for dental at Lift Up, there's no point in even coming in. So we had a young lady from a residential home north of Springfield come in. She came in for her appointment. It was about 1 p.m. Then she was back there. She had some issues. She was having a hard time understanding what was going on. I was in with the patient, and she's been, I think of all the patients in all these years, she's the only one that was vocal during her dental extraction. She was scared, didn't understand what was going on, so she was kind of hollering and hollering out, please don't do this or whatever, and her aide was with her. So about a short time after that, a lady stood up in our waiting room. We were 3 times as packed as what's in here. We had about 30 people in there. A lady stood up and she said, I think that's my sister. Well, that could happen, you know. So we looked at the file. Sure enough, it's the last name. Now, this lady had been in a residential home 30 minutes. Did I say south in the first one? I think I should have, not south of Springfield. She was from a residential home north of Springfield, 30 miles. Her residential or her aide said, you know, I don't think it's going to be possible, but why don't we try to sneak and get into lift up and see if maybe there's a cancellation and we can get in today. So she took a complete chance of coming in the afternoon because we would never see something. There's no way. So she's sitting there and we're like, yeah, it's the last name. So we took her to the young lady in the room that was hollering and they just stopped and they started crying and grabbing each other. And I was like, whoa, there's something major going on here. So what happened is that 15 years earlier, their family had been torn apart in the middle of the night. Neither sister even knew the other one was alive, where they were at. Now you tell me how at 7 years old, the young one in the chair and the older one that was only 10 years older, now 15 years later, recognized her 7-year-old at the time sister's voice, who's now 17, and she's 30-something, and had to have crossed, because if the young lady had not made any noises, they'd have crossed between exam rooms. You'd never know. All these years. So that was a miracle. It was meant to be. Those are things that truly happen in lift up. So we see the miracles. So what happens is it gets a great chance. We let him speak for himself a lot of times, and it's the greatest voice when he speaks. Yeah, absolutely. Yeah.
What do you do for follow-up care? How do you go ahead? You've had the initial visit. You have a lot of diabetics, hypertension. This is long-term chronic care in the best of situations. How do you go ahead? Do you schedule people out monthly? How do you get people to come back? A lot of people may not have a reliable vehicle or a young vehicle that can go in bad weather.
Right. So we have several things can happen with this. The first thing that can happen is that we never know who we do walk-in and appointments both, but most people, because they don't have cars, they take the bus, they don't know the bus schedule, so you can't just say a set appointment. So most people will just walk in. So when they walk in, you also don't know, because we don't ask for ID. So we don't, we do hand charts because, again, you must think mission here, okay? This is not like a typical doctor's office, well, let me make this. Now, some patients were able to say that are from here, have ways to get here and know they can get here. We'll make an appointment, that's not a problem, and most all of them absolutely follow up because they finally are getting medical and dental care for the first time in their life. But there's a lot of people that we know, when they come in, we've got this one shot. That's it. We'll never see them again. And we do everything that we possibly can on that one visit because we know we're not going to see them. So at least we give them what they can as they move on down the road or they're transient or whatever. Most people, if they've got something that serious and they're where they can come back, they will. And, we really have to wait for them to kind of walk into the door. So it's a very different situation. So many times there's many times we just don't, we do everything we can in that visit, whether it's a medical treatment, I've sent people home with a bag of medication that I know they're not coming back, but I know that if they don't have this medication, so, a lot of people donate, a lot of like hospices and things like that. People will donate medicines that haven't been opened. So we can send people home with their medicines. Yeah, that's about the best we can do on that.
Those are great questions.
They are.
Great questions. Another question, yes, back there.
Yeah, you're obviously very, smart, but in your 50s, how did you handle the MCAT and the application process? Where did you go to medical school? And you do have a branch in Branson? You do?
We have,
These are 3 questions. Or 4.
I noticed that. I can't count still, but yeah. So the clinics, Springfield, and then I have Ozark, right there at by the Lambert's exit, and then Branson's right across from the new aquarium. It's an urgent walk-in medical clinic because we figure most tourism people, the visitors that go to Branson would rather, they're there for 1 week. They have saved all year for this 1 week. The last thing they need, if they're going to Branson, they're going to eat everything that they're not supposed to eat, right? Okay. So we know they're going to have a lot of gut aches. So the things that happen to them are not serious. Now, we have had a few serious things. We send them to the emergency room. The rest of the things, we can get them in and out. You see a doctor every time. We have all doctors working for us. You see a doctor, you're probably in there in the doctor's phase in 10 minutes and you're out for a very inexpensive price. So you're not leaving thousands of your whole vacation at the ER, plus all night and all day anymore. So that's one thing. But as far as, okay, so that's where the clinics are. And so now what was the
MCAT.
Oh, yeah. Oh, no. Okay, so you're going to laugh at this.
School.
So medical school thing. So when I finally realized that's what I was going to do. So I was like, I didn't realize that age plays a huge difference. Okay. I said, I don't think that way. I can run circles around 30-year-olds still today. Okay. But the schools and residencies do not think that. And they will tell you that to your face. If I did that to an employee in my company, I'd be sued to the end of time. Residencies will look at you in your face and say, I actually had one go, well, you do know the requirements of our program, right? I'm like, well, I'm going to save you the time and go ahead and leave, sweetheart. So anyway, so the MCAT, so I'm looking at U.S. schools. U.S. schools in Canada are the only medical schools in the United States that require the MCAT. Stupidest test you'll ever take in your life. The rest of the entire world who has the same medical schools, U.S. thinks they have everything cornered in medicine. Well, let me tell you, U.S. ranks about in the 20th somewhere in medicine care. That's why other countries do such an amazing job, because they're more interested in getting you better. Like all the other countries that the U.S. give you your diabetic medicine, because they figured out it's a lot cheaper if they give you the medicine to take care of things than taking care of all the complications that come along with diabetes, okay? So saving billions of dollars, but we're still kind of working on figuring that out. So I went, I was like, well, to go to U.S. school, I have to have the MCAT. So I went to Barnes & Noble, and I went to that section, pulled the book out on MCAT. I opened it. I just broke out laughing. And I closed it and I put it back. So then I went and found out, oh my gosh, there's more medical schools, all over 2,800 medical schools around the world. So I went to Curacao because, well, one, I love the Caribbean. Number two, if I'm going to study like this, I want left alone. And that's what I did, and it was the greatest experience. And this is why, like, if I have to hire a doctor, I'm going to hire one from the Caribbean all day long. And I'll tell you why. You go to the Caribbean, you better want this really, 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 really bad, because you have to do it yourself. No MCAT, if you can breathe, you can get in a Caribbean school. Then you got to pass your U.S. boards. If you pass those, you're level with any doctor in the United States. Same boards. So that's what I did. And I didn't have to take the MCAT. And then I passed, of course, all my boards, not a problem. So I enjoyed it, but yeah, it was the greatest thing I did, but here's why the Caribbean was the greatest. I was from the Springfield area. We're very protected and conservative here, right? Okay, well, when you leave outside of this area, it's not that way. I learned people from all over the world were there. They put their pants on they had the same dreams. They wanted the same things. They worked just as hard. So diversity, I learned that. I care about every person. And you better want it. We put up with hurricanes, weird creatures. Let me tell you, you have no idea. No electricity, no internet. You better want to do it if you go to the Caribbean. So if you make it through that versus the students up here that have nice air conditioning, they have car, they have nobody breaking into your house at night, they do really well up here. So I'll take the Caribbean all day long. So don't anybody think you Caribbean's less of a doctor, because they're not. They're greater.
Did we answer your questions?
Yeah, I had no idea.
Yeah.
My daughter's taking her MCAT right now.
Go for it. I always tell people, if you can get in a U.S. school, absolutely, of course, but no one go for it.
Yeah, so here's 2 minutes.
2 minutes.
You got a question?
No, I didn't.
Oh, you did.
Okay. All right. Very good. Well, and by the way, she's exactly right. Dr. Derges passed the same boards that every other doctor takes, whether you're a medical doctor or a doctor of osteopathy. I have many, many friends, or both, and they're the same. They have a little bit different philosophy, but they're both taking the same board. She passed that, passed step 1, step 2. Usually you don't pass step 3 until after you take your residency. She passed it.
I passed all 3 boards, step 1, 2, and 3 in less than 1 year. I don't know anybody else that's done that.
So
That's a 3-year process.
So really quite a unique person. And so we're going to be wrapping it up. But we thank you so much today for being here and just being able to have the privilege to kick off Axe Fest, a 3-day event, July 15th through the 17th. What I like the most about the Axe Ministry group is I got involved with Jim and Pam Winey several years ago because of autism. Jim had both sons that were highly autistic. That causes many, many problems in his families and families around the country and the world. And so he talks about that from time to time, and it's very interesting to hear his story. But I volunteered with Axe Ministry because of my pharmacy groups. I had 26 stores, and I had 125 nursing homes that I served. Many of those nursing homes were children group homes that were autistic. And so I saw firsthand what kind of medications they had to take, just their life, the way their life was. It was sometimes pretty awful in those group homes and things like that. So I wanted to help in any way I could through Axe Ministry. So that's basically how I got started. But thank you very much for being here today. I tell you what, I hope that people will tune in. The thing you can do, if you're watching online right now, be sure and share this with your friends, family, neighbors, where you go to work tomorrow. If you're working tomorrow, Friday, be sure and tell people about Axe Ministry. They can watch it online on Axe Media Group's Facebook page. You can do that. Just be sure and tune in to shows Monday through Friday. We have great shows. The best, like I said, is on Wednesday at 10 a.m. when I do a show with Don Blackard. But you know, we have so many great shows that will bless people. We're just normal people. Just normal people. We've got problems too, okay? But through that show, Changing Times, we can make a difference. I know every Wednesday we make a difference in somebody's life. And that's really what it's all about, okay? And if you guys get